Thank you. Can people hear me okay? I think this is on. That's great. So I'm delighted to be here this afternoon, and I'm also really pleased to hear what a cross-section of people we have in the room. So hopefully the things that I share with you this afternoon will resonate with all of you, and I look forward to hearing from you in the panel discussion about your own experiences and some of the things you need to be able to engage in advanced care planning. So briefly, what am I going to talk about? A little bit about what I mean by advanced care planning, why it's important, why we should all care about advanced care planning no matter who we are. How do we do it? So I'll just sort of give you the 101 version of, how we actually do advanced care planning, and then what resources do we have available to help everybody. And just so you know, we have an exhibit in the exhibit hall where we have our resources with us, so please come by and see us. And Helena Toll, who's our assistant on the project, is there with me, and we can answer any further questions that we may not get time to deal with in this short time that we have. So how many in the room have heard of advanced care planning? A few of you, okay. How many in the room have actually made a plan or engaged in advanced care planning in some way? So a few less. So that's very consistent. You're very consistent with the Canadian population overall. So I'd like to stop for a minute and just say, what do I mean by the words advanced care planning? Because there's a lot of confusion out there. There's a lot of different terms that are thrown around, and it really makes it that much more difficult for people if we don't understand what we're talking about. So the most important things about advanced care planning is it means thinking about our values, reflecting on our values, what's important to us, what gives our life meaning, what makes us happy every day. And thinking about our wishes for future care. So what might we want? What kind of care might we want in the future? And particularly having conversations about what we value and the kind of care we might want with our loved ones, with our healthcare providers, with our circle of care, and particularly with our substitute decision maker, or that person who will make decisions for us when and if we're not able to make them for ourselves. So that person that our healthcare provider will turn to and say, what should I do now? The most critical thing about advanced care planning is having conversations, and having many conversations, not just one. So sometimes we get caught up, certainly in the healthcare system, and all of us have had experience with the healthcare system, filling out forms and writing checklists and trying to get short, concise answers to difficult, complicated questions. So advanced care planning is not about a form or a checklist. It's a process. It's a process, as I said, of thinking, reflecting, and talking. It's not a one conversation. It's not one question. Do you want to be resuscitated? And that's where many people go when they think about planning for future health care. That's not what I mean by advanced care planning. And as I said, particularly, one of the most important things is to think about who your substitute decision maker would be. So central to it is conversation. And conversations need to begin early. And actually, the latest point at which a conversation should begin is at the time of diagnosis. Diagnosis with the brain tumor or diagnosis with any serious illness. In our thoughts, that's the latest time the conversation should begin. We'd like people to start those conversations when they're young, early in life, so that they've started to think about their values and they think about the things. What if I walked in front of a bus and got hit? What would I want? What would be important to me? So we really want people to think about these things early. So what do we know? Fewer than half of Canadians have actually had a conversation with their loved ones about, what kinds of interventions, treatments they would want if they became seriously ill and could not speak for themselves. So in fact, you're pretty representative in the room about what we know about the Canadian population. At the same time, 80% of Canadians think this is important. So we think it's important to do this, but we're not doing it. Only 2 in 10 Canadians even know what advanced care planning is. So as I said, 80% of us think it's important. Less than half have done it. Only 9% of Canadians have spoken to a healthcare provider about their wishes for future care, about their values, about their wishes for care if the time came when they couldn't speak for themselves. So why don't we do this? We think it's important, and I'll show you some research that indicates we know it's important, but we still don't do it. Well, we were involved in some polling of Canadians. Harris Decima was the company that conducted the polls for us. And we found that almost 40% of Canadians said they were creeped out by having this conversation about the kind of care they'd want in the future. And so people are really uncomfortable, or almost half of people are really uncomfortable with this. 41% were afraid of upsetting their families. So they don't want to start these conversations because they don't want their families to get upset. They don't want their families to think something's going on that we haven't told them about. They don't want their families to feel that there's no hope. 45% of people are afraid of death. And that, in our culture, we are sort of a death-denying society, very much in Canada. We haven't had a lot of experience with end of life, with death and dying, and so people are afraid of it. So they're afraid to start this conversation in case it goes there. And 43% say they're just feeling fine, thank you very much, and they don't have to have this conversation. They're healthy, or their illness is being managed well, they're feeling fine. This isn't really relevant to them. So why is it important then? I mean, if less than half of us are doing it, and we've got all these reasons why we don't do it, why are we still saying that this is very important to do? Well, as you all well know, healthcare decision-making can be very complex. And it's not something that we can't make decisions about our current healthcare, let alone our future healthcare, in a very short period of time, in one conversation, in one visit with a healthcare provider or one conversation with our family member. And the research has shown us that if we start thinking about our values and our wishes for future care in sort of what-if scenarios, that actually prepares us to make decisions better in the moment when we do have to make treatment decisions, decisions about life-sustaining interventions, decisions about things like resuscitation. So if we've started to think about our values, what brings our life meaning, about what kinds of care we might face in the future, when the time comes, we're better prepared to make those decisions. It's also really important for us to know that advanced care planning, or talking about our wishes for future care, definitely eases the burden on our loved ones. If we become incapacitated, we can't make our own decisions, and our loved ones, family, whoever that may be, are called upon to make decisions on our behalf. If we've had these conversations, if they know what our values are, even if they don't know specifically what we might want in this instance, but they know what brings our life meaning, they know what makes us happy, the research has shown us that it's less burdensome for them to make a decision. I'm not suggesting that decisions are easy, quick, or simple, but we do know that if we've had these conversations, they're less burdensome when the time comes. So I just wanted to give you a synopsis of what the research has told us, and the slides will be captured so you can look back at this and look for more information if you'd like. But people who have engaged in advanced care planning, so reflected and had conversations and appointed a substitute decision maker, someone to speak on their behalf if they are unable to speak, they're more likely to have their wishes known at the end of their life, and most importantly, to have them followed. So we have lots of research that shows that people, let's say someone enters the hospital at the end of their life, which is where most Canadians die, that there's good research to show us that very often what they want is not what's documented on their chart. It's not what healthcare providers understand, or maybe the healthcare providers have never even asked them or their substitute decision maker. But if we engage in this process, that's less likely to happen. And I mentioned that family members have less burden. In fact, the research shows us that if we do have these conversations, family members are less anxious, less stressed, and less depressed when it comes time to making decisions about care, and certainly when it comes time to them supporting their loved one at the end of life. We are all more satisfied with our care if we get the kind of care that we want. And our families are more satisfied as well. And in fact, research has shown that people who engage in advanced care planning conversations are less likely to have admissions to the intensive care unit at the end of their life and life-sustaining treatments at the very end of their life. And in fact, what the research has shown us that people are less likely to have these life-sustaining interventions or admissions to ICU because they didn't want them. So they expressed their needs that at the end of their life, they want, what they wanted, and they in fact got what they wanted. And they have a better quality of life and death, and that's our goal, certainly in the work we do in hospice palliative care, but the work we do throughout caring for people. Our goal is that people have a good quality of life throughout their life. And I think that really echoes what Elise talked about in her rehab presentation. And in fact, we find that there's less costly care at the end of life if people have advanced care planning conversations, and that's directly related to the fact they don't have things they didn't want in the first place. Some people get nervous about that and say, well, people are going to use advanced care planning as sort of a cost-cutting measure for the healthcare system. But in fact, the outcomes that we see to advanced care planning are much greater for the patient and family in terms of quality of life than they are in terms of cutting cost. So there was a study done in Canadian hospitals, and I like to highlight it because it's Canada. It was done in 3 or 4 provinces in the country, that showed that when patients were admitted to hospital, 3/4 of them had thought about their wishes for future care. They thought about life-sustaining treatments. They thought about what they might want. 85% had talked to somebody. 70% had formally decided on their substitute decision maker. But only 30% had talked to their family doctor. Now, these are people who are being admitted to hospitals, so clearly they're in the medical care system. But the scary thing was that only 25% of them were asked when they were admitted to hospital if they'd done these things, were asked by a healthcare professional. So I'd like to move on a bit and talk about how we do advanced care planning. And this is going to be pretty high level, but it just gives you a taste. And there's resources at our booth that you can pick up that can help you go further with this. So we've sort of broken this down into 5 steps. I'm not suggesting these conversations are easy or this is an easy thing to do, but we've tried to put a structure on it so that it makes more sense to people, so they can take it in bits and bytes and work through it. Otherwise, people have said to us continuously, I want to do this, but it's overwhelming. We sit down and try and do it, and we just become overwhelmed. We don't know where to start. We don't know what to say. Emotions run high, and of course they will. So it's very overwhelming. So we've broken it down to 5 steps. Think, learn, decide, talk, and record. So thinking about your values. What makes my life meaningful? What do I value most in terms of my physical and mental health? Recognizing that changes. That changes through our life course, and that changes through our disease course. So what we think today brings us most what we value most in terms of our physical and mental health today will most likely be different from a year ago, and a year after that, and a year after that. So it's very important to reflect on these things on an ongoing basis. And then equally important, what would be important to me at the end of my life? And this is often where people, remember the creeped out answer earlier, where people get uncomfortable. But there's questions like, what kind of an environment would I want at the end of my life? Who do I want with me? Who do I not want with me? Am I worried about being in pain? Am I worried about not being able to breathe? Where do I want to die, at home or in hospital? What would change that for me? What would change my mind about that? So it's all of these questions that we can reflect on and talk to each other about. Then step 2 is to learn about your health, your illness, the current context of your health and illness, but also what you're going to expect in the next 6 months, in the next year, in the next 2 years, in the next 5 years. And I'm sure you've had a lot of conversations about that part of the conversation. Learning about your health situation in the context of your disease involves obviously talking to healthcare professionals, as well as to your family, and as well as doing your own research and looking up. But it's really important to revisit this step in the process regularly, just as we revisit our values. And then decide on a substitute decision maker. If we lack, what they say, lack capacity, we're incapable, we can't speak for ourselves, we can't make decisions for ourselves. The healthcare system turns to somebody, the legal system turns to somebody. And depending on the province where you live, the legal framework around that will be different. But in every province and territory, we have a substitute decision maker. It's important for you to know who that person is legally, and if the law is going to give you a substitute decision maker, and if that's not the person you want, you may have to fill out a form to pick the person you want. In some provinces, it's called a proxy, a power of attorney for personal care, a representative, a delegate. The words are different, but the meaning is the same. And then you need to ask yourself some questions about who you choose. Are they able to communicate clearly? Will they be able to make decisions in stressful situations? And are they willing and able to do this job? And that's very important. The person obviously needs to be willing and able. And the substitute decision maker needs to understand that they are making decisions based on your values and your wishes, not their own. And they have to be comfortable doing that. And not everybody is going to be comfortable doing that. And that requires a conversation to determine who that person will be. And then I know I've said this over and over again, but step 4 is to have the conversation. If we reflect on all of this and think about it and don't tell anybody and don't talk about it, we're not going to get the kind of care we want if we can't speak for ourselves. Conversations have to begin early, as I said, and they have to be revisited and revisited as time goes on. And then we recommend documenting your wishes. You don't have to do that in every province and territory. There are legal documents in some, not in all. But we recommend writing things down or recording it, audio, video recording it, however you want to communicate, because that's a way of sharing your wishes in a very living way with your substitute decision maker and your healthcare team. So I'd like to end by just sharing some resources with you that we've developed through our initiative, which is called Advanced Care Planning in Canada, or Speak Up, and we are facilitated out of the Canadian Hospice Palliative Care Association. We have a website that's sort of the cornerstone of our project, advancedcareplanning.ca, and when you go, remember I mentioned that legal frameworks are different. When you go there, you can click on the resources in your province and territory, and you'll get things that are meaningful for your situation. We have resources for patients, for families, for the general public, for healthcare professionals, and for organizations like your organization that you can use to advocate for advanced care planning. Our most important resource is our workbook, and you can see samples of it at our exhibit that helps you work through those 5 steps. And the workbook is available in a written hard copy or online in an interactive version where you can print out a PDF of your wishes and share it with your substitute decision maker. We have resources that have been developed in partnership with us through First Nations communities, specifically for First Nations Canadians. We have a wallet card where you can name your substitute decision maker. And as I said, we have tools that you can use, that the Brain Tumor Foundation does use, and your local organizations can use to get your community engaged in advanced care planning. We have tools for healthcare professionals to help them start the conversation. Remember I told you that only 25% of them did when people were admitted to hospital? Well, we have questions they can ask. We have scripts for healthcare providers to help us find the words, because it's difficult for all of us to find the words. We have videos. I encourage you to go to our website, go to our YouTube channel, and watch our videos. They're all short. They describe all the things I've been talking to you in clear messages, and they include people talking about their experience with advanced care planning. So I'll end there, and I look forward to questions when we sit down at the panel, and thank you very much.